My name is Andrea Branson, Education Program Specialist for the NANP. Joining me today is Dr. Kellyn Snow. So Dr. Kellyn Snow is a doctor of physical therapy and founder of Soul Pelvic Wellness Studio, a women's health practice serving Massachusetts, Connecticut, and Rhode Island. She specializes in pelvic floor, physical therapy, and whole body care, supporting women through pregnancy, postpartum recovery, pelvic pain, and other chronic health pelvic concerns. Dr. Snow has completed advanced training through the Herman and Wallace Pelvic Rehabilitation Institute and is certified pre- and postnatal coach through Girls Gone Strong. Her work is driven by a commitment to ensuring women feel heard, supported, and empowered in their healthcare journey. She lives in Webster, Massachusetts, with her husband and their Australian Shepherd, Denver. Welcome. And also joining me is Isabelle GianDomenico, who is board certified in holistic nutrition. Isabelle is a holistic health practitioner and owner of Sunrise Wellness and Holistic Health in Worcester, Massachusetts. Board certified in holistic nutrition and a certified dietary supplement professional, she supports clients through holistic nutrition, dietary supplementation, gut health, hormone balance, stress and nervous system support, chronic inflammation management. Living with multiple chronic health conditions herself inspired Isabelle to pursue a career in holistic health and specialize in women's wellness. She is passionate about helping women take a whole body approach to their health and believes it is never too late to improve well-being. Isabelle works with clients both in person and virtually. Thank you, ladies. I'm going to hand it over to you guys. Thank you.
Wonderful. Thank you so much for the introduction. Isabelle and I are very excited to host this workshop. We had hosted it previously for an audience more of our patients, and it had such a great response. And we were so excited to share it with providers and hopeful that maybe we can kind of encourage confidence around periods for providers and helping people have the conversations around periods and understanding more about how to and when to refer out and kind of things to look for. So we're really hopeful that we can provide you all with some information and really help build up your toolbox, your client's toolbox around period pain management and having, again, more confidence and just understanding about the topic. We have had countless conversations between the two of us about periods and period pain and how much of a lack of knowledge there is around it and how it really creates this kind of, now what conversation that we have with patients often. And so we really are hoping that this course or this workshop really answers, that kind of now what that very often comes up with clients.
All right, and just for a little disclaimer, we always want to share that the information that's shared in this webinar is not intended to replace the care of a medical doctor or a mental health professional and is not for diagnostic purposes, just for educational purposes only. And if you have any questions or medical concerns, please reach out to a medical provider of yours. All right, so I am Isabelle GianDomenico. I'm the owner of Sunrise Wellness and Holistic Health that's located in central Massachusetts. I'm a holistic health practitioner and board certified in holistic nutrition and a certified dietary supplement professional, both through the NANP. In terms of my education background, I have a Bachelor of Science in Public Health with a minor in Psychology, a Master of Science in Health and Wellness, and I have several different certificates, a couple of which I listed here. One that's an integrative approaches to pelvic pain in females, and one that's an introduction to integrative approaches to mental health, anxiety, and depression.
And I am Dr. Kellyn Snow. I am a doctor of physical therapy with specialized certification in pelvic floor and women's health related issues. I got my undergrad in public health and then, of course, my doctorate degree in physical therapy. I have been a pelvic floor therapist since the day I graduated from school, and it is really all that I've ever done. So I have quite a lot of certifications and deeper diving into treatment management techniques, such as dry needling, for pelvic floor related conditions. I also have my pre and postnatal certification coach. So I am able to kind of athletically train patients through pregnancy and postpartum with just kind of a different, broader lens for them. And so it's really exciting and it's it's been wonderful. And through kind of navigating pelvic floor PT, I decided to open up my own practice, which is called Soul Pelvic Wellness Studio. And it is a cash-based physical therapy practice located in Webster, Mass. And it's me and another therapist. And we recently moved to a new office and have expanded our team to include other healthcare providers to really kind of create this village of support for women, because there's not much around the area for them. So it's been really exciting. So let's start off by just talking about what a normal menstrual cycle looks like. It seems kind of funny that we have to even talk about this, but honestly, it can be so confusing. And I don't think most people actually even know what's normal. So it is really, really helpful to just get an understanding as you're talking to clients and patients about, okay, what is normal? Isabelle will talk about what's not normal and helping you understand what is actually signs that might indicate you might need to send them out to somebody else. So first off, a menstrual cycle should last basically 21 to 35 days, with the average being 28 days. The first day of your cycle is the first day of your period. And that is not spotting. That is true blood having to actually manage the period. And then the last day of your cycle, of course, is the last day before that period starts again. Your period length is on average between 3 to 7 days. Again, the first day is that first day of bright red blood. You have a consistent flow. And again, you have to manage it. It's not just that spotting. Then the average flow is about 2 to 3 tablespoons of blood loss throughout your period. It doesn't seem like a lot. You might kind of assume that it's more, but it really is only 2 to 3 tablespoons. The bleeding is usually the heaviest during the first 2 days. And then you can have small clots that are normal more on your heavier days. So if you do see small clots, they can be considered normal for your menstrual cycle. Your cycle typically will regulate around your 20s and 30s. Things that will cause irregulation tend to be adolescence, postpartum, perimenopause, or things that might affect your cycle like high stress. Oftentimes young athletes, high-level athletes in college can also have changes to the frequency and consistency of their cycles.
All right, so let's talk about in the opposite regard of what menstrual cycle red flags look like. And these are the things that you want to watch for in either your clients or your patients, or even yourself or different women in your life, your family member, your friends, to really be able to help people navigate what to look for that's a red flag with your menstrual cycle. So first of all, going more than 90 days without a period is definitely a red flag. So we don't want to go more than 3 months at a time without having a period. As Kellyn said, it should be about every, 21 to 35 days of having a regular period. So we definitely don't want to be going an extended time frame without having one. Unless, of course, you're on medications that are purposefully disrupting that. But if I'm just talking about a natural period without any intervention. Bleeding more than 7 days at a time is definitely a red flag as well. You want to make sure that your periods are normally between 3 and 7 days on average. So if you're bleeding more than 7 days, that definitely can increase, the risk of different things like anemia because you are bleeding for an extended period of time on end. Spotting throughout your cycle, Kellyn mentioned that as well. So you want to make sure you're only bleeding during your period. So during that whatever 3 to 7 days that is your average period, you only want to bleed actively during that time. When you're not on your period and you're in any other time of your cycle, you definitely do not want to have any bleeding of any kind. It's definitely a red flag to talk to somebody about. If you're having vomiting or extreme nausea, severe cramping or extreme pain, this is what I'm talking about in terms of disrupting your life. So if you have to call out of work, you have to call out of school, if you're just sitting on the bathroom floor next to a toilet because you think you're going to throw up the first 2 days of your period, these are red flags to look out for. So if you know somebody that's experiencing this or you're experiencing it yourself, definitely talk to a medical provider. Things like extreme pain during the first couple of days of your period can be indicators of different pelvic pain conditions that we'll get more into. So it's definitely something you want to bring up. Very heavy or very light bleeding during your period as well is a red flag. So you don't want to have, like she said, such light bleeding that you don't know if it is even your period, but you also don't want to have such heavy bleeding that you're having these clots that are larger than the size of a quarter, flow so heavy you have to change your pad or tampon every hour or two. I've heard of women having to wear diapers on top of pads because they're bleeding through it so much. If you're having to fear going out in public because you're worried you're going to bleed through things, these are very abnormal signs. These are red flags you definitely want to look out for. And one tip to help people learn, how many days am I having, without a period? How many days long are my period? Is to help them properly track their cycle. So what you want to do is on the first day of your period that you're actively bleeding, you want to mark an X on the calendar of that day. Or for example, like the little calendar that's on our slide here, this is a little flow symbol. That's your day one of your menstrual cycle, is day one of your period. After that, you want to put an X for each day that you're actively bleeding. This is your period. Once that you're done bleeding, then you stop putting X's on your calendar. So then you want to count up all of the X's, starting with the first one on your calendar, and that's how many days long your period is and how many days of the X's plus the blank days on your period before you start marking another X again is how long your cycle is. So for example, if day one of your period is the first little flow mark that's on that chart, and then you have a couple more weeks, whatever your last day is without bleeding, without that X on the calendar, that's how many days you want to count up to see how long your cycles are. And this is not something you want to do just once. You want to make sure, if you're asking your clients or patients to track it, that you're tracking it consistently for a few months and take the average, because there is some variation that can come with it. It's not exactly, you have to be 28 days every single time, but you definitely want to make sure that you are tracking it properly to get that average to be like, I skipped a period this month, but the other month it was getting 5 days shorter every single time. You want to make sure that you're hearing these things and tracking them with your clients in order to actually help them manage their periods better.
And the tracking is really important because there's such a wide range of what's considered normal that it really is helpful to be able to track it and look at patterns. If there was 1 month that you had, really crampy discomfort, but then every other period after is normal, then I wouldn't jump to having this immediate concern that something is wrong, right? There might have been factors. We might have been really dehydrated. We might have had a lack of, certain vitamins that increase muscle cramping. Like, there are things that are not concerning and red flag that might fall in this list. So you're looking for patterns, you're looking for things to get worse over time. And so the tracking really, understanding what's normal and being able to properly track it first and foremost makes a huge difference in your understanding and your patient's understanding of what actually is happening. So it's a great tool.
Yeah, and the symptom tracking as well is super important.
Mm-hmm. Yeah, absolutely. So let's get into, we kind of highlighted some diagnoses and issues that, you might commonly hear patients on their past medical history list, or maybe it's something that you're going to start feeling is popping up in more patients that maybe don't have it on their past medical history list. So the first diagnosis we're going to talk about is dysmenorrhea. So dysmenorrhea is the term for painful periods or menstrual cramps. So it is very common. It is, very common, but not normal to have something that is really painful or to have cramps that are really painful. It's not something that you should have to push through. So understanding that painful periods can be normal, can be common, and understanding when to then trigger you and kind of like your red flag to say, okay, this pain seems like it's more than just the average period pain. So you have two types of dysmenorrhea. One is primary dysmenorrhea and two is secondary dysmenorrhea. So primary dysmenorrhea is having painful period cramps that come with your period and are not because of any medical condition. That is basically the uterus is contracting. We have prostaglandins that are present and there are cramps. That is not normal. It should be uncomfortable. We should notice them, but we're not popping pain meds. We're not skipping work. Like Isabelle said, we're not laying on the ground because we're so nauseous from the pain. That is then where you become concerned about secondary dysmenorrhea. So secondary dysmenorrhea means that you have that cramp that occurs either in your period or outside of that cycle, and it's due to something underlying, an underlying medical condition or an infection. So commonly we're talking about endometriosis, adenomyosis, fibroids, or like I said, sometimes an infection. So this is now where that patient is complaining about pain that is so bad that they have to plan their life around it. They're calling out of work. They're taking significant amounts of pain meds. And they're having pain, that's their period pain, that's not even during their period cycle. So having cramps does not automatically give you that red flag that something is wrong. You're again looking for the patterns that it's lasting longer. It's getting worse every month. We're having to have more interventions because of the pain and more limitations in their quality of life.
All right, so we're going to talk about endometriosis as one of these first examples of what she was talking about with dysmenorrhea, the secondary dysmenorrhea. So endometriosis is a chronic illness that occurs when tissue that is similar to the lining of the uterus implants in different areas of the body. This impacts about 1 in 10 women. It's believed to impact about 190 million women. So it has a huge impact most of the time on quality of life and has very debilitating symptoms that occur. Some of these symptoms can include chronic pelvic pain. So we're talking about pelvic pain that's not just with your period, but all throughout your cycle, but is worse during your period. Bloating, which you can classically kind of see as the endobelly that people refer to. Very painful periods. Again, this is when people are often calling out of work or school because the pain is so debilitating. Very heavy bleeding can come with it. Pain with urination and or bowel movements. Anxiety and depression. This often is a sign just because of any chronic illness can be very debilitating, isolating. Also, it's very anxiety provoking when you keep being dismissed by doctors over and over again. And unfortunately, women with endometriosis are often dismissed in really fighting for their own care and fighting to get that diagnosis. So there's a lot of anxiety and depression that can often come with that. And also we'll talk more about later, like fearing your period, having to cancel plans. All these things are very isolating, impacting on mental health. Infertility can be a sign of endometriosis. Some people actually don't even know they have endometriosis until they start trying to get pregnant, and then they will go for fertility testing and end up getting an endometriosis diagnosis that comes after that. Endometriosis is a very funny disease because on one hand, you can have no symptoms and end up infertile, and other women have extremely heavy, painful periods and have no problem getting pregnant. It's been found in about 30 to 50% of women with endometriosis end up having that trouble conceiving. Then there are other issues that can come with it. Fatigue, of course, that comes with chronic pain, and GI issues, constipation, diarrhea, rotating constipation and diarrhea. Honestly, a lot of women end up having an IBS diagnosis before getting an endo diagnosis. The clients will come to me and be like, yeah, I have an IBS diagnosis technically, but that was before I was diagnosed with endo. So I'm pretty sure it's just because of that, because there's a lot of misdiagnosing that does happen because of the GI issues that come with it. There is a very big diagnostic delay because of this lack of being able to recognize the symptoms early enough. So it takes about 7 to 9 years to be able to get a diagnosis after symptoms come on. And unfortunately, there is no correlation between pain level and symptoms to the staging of the condition. So surgeons can go in and find a ton of endometriosis, but your symptoms are very small, or you could have a ton of symptoms and be, stage 4. One has nothing to do with the other, or you can have stage 1 and have horrible symptoms. It's a tricky condition for that. So people have to make their own choices on whether surgery is a good fit for them for that standpoint. And of course, there's different things than people like Kellyn and I that really work with women that have endometriosis to provide them with either alternative or complementary avenues to that traditional care.
And with endometriosis, basically, a lot of times their first way of managing it and treating it is through birth control. That will then, kind of delay the diagnosis by a couple of years because they have to go through the cycle of trying it and seeing if it works and trying new ones. And then in order to actually get a true endometriosis diagnosis, you have to go under a laparoscopic surgery to actually diagnose it. Then for management of it, they'll do an excision surgery, which is an actual cutting of that tissue and removing it. There are still surgeons that do an ablation surgery, which is that they burn that tissue out. That is actually no longer the gold standard. So unfortunately, there's a lot of providers that are still doing that surgery and actually creating more scar tissue and not actually removing the endometriosis. And it's, again, delaying the actual true care that women need. So I always want to emphasize that when you're talking to patients, even if it's not within your scope to be managing endo, if you are having a conversation and they're mentioning that a surgeon is doing an ablation, I would kind of just red flag them and say, hey, I have heard some information that really the gold standard now is excision. I would, explore that a little bit more because it does cause such a delay in patients' care and causes even worsening symptoms. With an excision surgery, a lot of patients will have a full relief of symptoms post-op. Some patients have no change whatsoever. So it's not an automatic guarantee. There's patients who will go through multiple of them in hopes that they will improve their symptoms, but it's always important to understand that even if you have a surgery, it might not fix everything or take away all your symptoms. In terms of PT, my attitude is that endometriosis, I can't touch it, I can't remove it, I can't treat it, but I can treat the entire area around it. So making sure that the tissue around that endometriosis is moving well, all of our bowel habits, like Isabelle, from what we mentioned, what we can control, we're doing a good job at. So this is a diagnosis that really, truly benefits from that toolbox management, whether we're using birth control or surgery or having further medical interventions.
And there has been a very big push lately too for a clinical diagnosis because of the issues around surgery, the very few surgeons that are actually experienced to be able to do that excision surgery. And because the recovery, you only can sometimes have a month or two of relief. And there's other compounding conditions like Ehlers-Danlos syndrome that really cause increased risk by having surgery. So it really is an individualized decision to be able to have that surgery.
Yeah. Now, the next diagnosis is adenomyosis. Very commonly, it will occur with endometriosis, but it can occur on its own. So adenomyosis is when that same uterine lining is not growing inside the body in different places like with endo, but it's actually growing within that muscular layer of the uterus, which is not where it's supposed to be. So because that tissue is growing within that muscle layer, that uterus will start to become thicker, heavier, it can become enlarged, and there's a significant amount of pain and pressure that's associated with adenomyosis. That tissue responds to hormonal changes because it is within the uterus. So during your cycle, it can lead to more inflammation, stronger uterine contractions, which therefore will increase pelvic pain, bloating, period pain, the amount of bleeding, and then outside of your period, you can have issues of infertility or any of those symptoms continuing outside of that menstrual cycle. The symptoms of pelvic pain can be related to, like I said, your period, or they can be constant. They can feel really deep, really heavy, and really achy rather than sharp and shooting. The bloating is often due to the increase in that uterus thickness. The heaviness from the increase in the thickness and the inflammation can contribute to more of that bloating. Again, the painful periods are going to be increased because that uterine lining is already so thick and crampy and inflamed that those regular period cramps are now getting worse. And then we have the infertility, which of course you can imagine if that uterine lining is having an issue, then the planting and kind of maintaining of that embryo during fertility then can be affected. So this is something to look out for. Again, not necessarily is one symptom indicating that you have adeno. You're looking for patterns and consistencies. Severe worsening period pain and bleeding are, interfering with your daily life.
All right, the next one I want to talk about is PMDD, or premenstrual dysphoric disorder. So this is a condition that causes a more serious version of PMS symptoms that can include both physical and emotional symptoms. And again, this can impact about 1 in 10 menstruating women. The symptoms usually occur in the weeks before your period, often starting about on average 10 to 14 days before the period starts. And then the symptoms tend to end within 1 to 2 days of the period starting. There's a lot of different symptoms that can come with it. In terms of the physical symptoms, they can include headaches, cramps, bloating, breast tenderness, fatigue, low energy, cravings, and changes in appetite. In terms of the emotional symptoms, it can be increased or severe anxiety, depression that can come with the suicidal thoughts, mood changes, feeling on edge, anger, and panic attacks. So one part of this protocol that's so huge is looping in a really good therapist, because especially if you're hearing in your client that they are having severe depression, anxiety, the panic attacks, those suicidal thoughts, you want to make sure that they have somebody in their corner that they can talk to. And if it need be, looping in a psychiatrist or an OBGYN, that if they need medication to make sure that they are, that they're not having those suicidal thoughts and extreme depression, then, whatever works for them, as long as the person is safe, that's really what we want to look at, and really helping them get the care that they need. Sometimes for even a holistic nutrition professional, it can be out of our scope of practice when dealing with those types of different things. So we want to make sure that we are referring out when need be. For us, stress management is a hugely important part of PMDD because of all the emotional symptoms that can come with it. So you want to make sure that you're managing stress as much as you can. And we'll talk about stress management as part of their toolbox protocol coming up more towards the end.
And now we have PCOS. So PCOS is polycystic ovarian syndrome, and just recently that name got updated to polyendocrine metabolic ovarian syndrome, which is a huge win for women. It is going to improve the diagnosis of women and really, really make a huge impact, because with the name being polycystic ovarian syndrome, it implies that there should be cysts in order to have PCOS, which was not true with the diagnosis of PCOS. You could have it without having ovarian cysts, but because of the name, there became a huge misconception that impacted actual truly getting diagnosis for women. So the reclassification and the renaming of it was a massive improvement for patients who struggle with it. So like I said, it is PCOS historically, which is polycystic ovarian syndrome. It is a condition that impacts hormone regulation due to the ovaries producing extra hormones. And those hormones tend to be androgens. So those are kind of those masculine-y hormones. So that's why you'll have an increase in hair production in different parts of your body. You'll have an increase of acne, an increase of weight gain, things that are associated with those androgen hormones. So this affects multiple systems within the body, hence the new name for the metabolic part of the new name. So you can have irregular periods. They can be infrequent, unpredictable, or even absent due to the irregular ovulation that occurs. You can have acne, again, related to the increase in the androgen levels. Same thing with excessive body hair. With obesity, you can have, not everyone with PCOS will have obesity, but PCOS is related to insulin resistance, which then can contribute to weight gain, or even losing weight can become a lot harder for patients. You can actually also have some scalp thinning of your hair, even though you have an increase in body hair. So that's something else to look out for. Ovarian cysts, like I said, they're not required for you to have a diagnosis, but they are very commonly present. And you can have infertility issues, again, because ovulation is challenged. It can make conception more difficult. And then a lot of people with PCOS actually don't receive much support kind of for fertility. There's more focus on kind of other diagnoses. So it is important to consider that PCOS, or the new name, and really look out for a diagnosis. So that way, if you are interested in trying to become pregnant and there's some challenges, it really does help support the need for infertility services by having some of that diagnosis support on your side. So symptoms can change over time. They can improve with the right treatment options. It really does vary for every person. There's not kind of a consistent presentation of PCOS. You can have a combination of these symptoms, or you might just have one or two of them. So definitely understanding the variety within this diagnosis can improve your confidence with having that conversation with patients. Again, not to diagnose it for them, but understanding when to send them out for further management by another medical professional.
All right, next is uterine fibroids. So uterine fibroids are non-cancerous growths that occur on the uterus. They usually occur in 40 to 80% of women, usually between the ages of 30 and 50 years old. So with fibroids, they are typically non-cancerous and they almost never turn into cancer. That being said, if it's suspected when people come in, you want to make sure that you have a solid diagnosis before assuming that it is a uterine fibroid, because if it is cancer, obviously we don't diagnose that. So we want to make sure that they have a solid diagnosis before starting to work on a protocol with them. The size of the fibroids, again, like all these women's health conditions, you're going to keep hearing Kellyn and I say it, there's so much variation all the time. There's a very big range. It can be too small to see with the naked eye to being larger than the size of a grapefruit. That is how much of the range it is in size of these fibroids. The symptoms, again, can be really tricky. Some women have no symptoms. It just really depends on the location, the size, and the number of the fibroids that they have. So if they do present with symptoms, some of these can include pelvic pain and pressure, heavy bleeding, bleeding between periods. Again, we talked about that spotting between periods as a menstrual cycle red flag, the period pain, constipation, lower back pain, urinary frequency, and an incomplete bladder emptying, and a larger appearance of the stomach. There can be complications that come with the uterine fibroids, such as anemia or fatigue from the heavy bleeding that they experience. So it's really important to refer your client out to a doctor or medical provider to do like iron deficiency anemia testing if they have fibroids.
And I actually see a lot of patients with uterine fibroids because if you look at the list of signs and symptoms, almost all of those are things that people are coming to pelvic floor PT for. A lot of patients will have them, they'll be small and they're just kind of managing them. Other patients might have had a hysterectomy to actually deal with the fibroids. So with and without surgery, there is a benefit of pelvic floor PT because as you can see, constipation, back pain, urgency, frequency, all of those things have an impact or are impacted by the muscles and the joints around that uterus. So even though you won't touch the fibroid, you can improve the area around that fibroid. Post hysterectomy, I would even advocate is even more important to see pelvic floor PT because oftentimes people say, well, the problem has been removed, so I'm good. Whether that's a hysterectomy for a fibroid, it's a hysterectomy for heavy bleeding, or maybe we're having a prolapse and we've had a hysterectomy to remove that organ. You still have either things that got you into that situation in the first place, or you have compensations within your body that have developed from dealing with this fibroid for so long. So I do recommend that if you are having patients or even friends and family who are going through surgeries for any of these diagnoses or also any other diagnoses that might be relevant, I would encourage them to have somebody on their care team to be looking at them and saying, hey, you look great, but X, Y, and Z can maybe be a little bit better. So that way in 5 or 10 years, your surgery doesn't now fail if it's something that could fail, or you won't have created another problem by having the surgery. If you think about the uterus being removed, there's now a huge gap between the bladder and the rectum, and things will shift. And when things shift, you can start to have problems. So it's always important to understand the benefit of post-op PT, even though we might have kind of fixed the issue. So now we're going to get into, oh, go ahead. Well,
you're good. All right. So next we're going to talk about the false common period misconceptions. So unfortunately, there are a lot of common misconceptions around periods that are completely false. Pain and suffering is often normalized in women by medical providers, but also other women who have just it's translated into this generational normalized suffering. For example, many women with endometriosis who have been diagnosed more recently have explained to their mothers and grandmothers what their symptoms are of endometriosis, and they're thinking back and going, wow, okay, that was normalized that I had to call out of work or school because my pain was so bad, or I had to wear a diaper because my bleeding was so heavy. I didn't realize that that wasn't normal. So people are looking back on it, and now Kellyn and I are trying to be part of the movement to break down these barriers and say, we got to talk about what's normal, what's not normal more now, because there's so many misconceptions that have built up over the years. And we really want to help you also help your friends and family and clients to be able to recognize these things and get the care that they deserve sooner. We believe that women deserve more care and support than they're getting, rather than just be told it's part of being a woman.
yes. Heck yeah. Yeah. So like Isabelle said, I hear all the time as well where I'm getting a patient to get a diagnosis of endometriosis and they come back, or even hypermobility. We mentioned Ehlers-Danlos syndrome earlier, and they come back and they say, yeah, so I was talking to my mom, and now my mom actually also probably has getting diagnosis for endo, and my grandmother. And I think breaking down that general misconception is a huge, huge part. And not only the generational misconception within the families, but so much more, I think even more importantly, is the doctors, because so often I myself, Isabelle herself, our patients have gone in and had conversations with these doctors and have been so dismissed and so brushed off, and it's caused a ton of hurt and delayed care. And it really, really, there's a huge movement to improve it, and we're getting better and better every day, but it's still not great. So some common misconceptions that we hear all the time is it's normal for periods to prevent you from attending work or school. I remember in school when I was in elementary school and my friends were getting periods, kids were getting called out of school all the time. And they were like, yep, it's just part of having your period now. I guess it's just being a woman. And like we mentioned earlier, that pain should not prevent you from living your life. That is a sign that something more is going on. And again, if you have 1 month of a period being painful, but everything else is normal, then it might not be concerning. We're looking for patterns. Some women just live with chronic pelvic pain and daily cramps. It's just part of being a woman. You often hear that just kind of part of being a woman with things like menopause and postpartum and getting your period for the first time. And this idea that women are just suffering and that's kind of just what we do and that's kind of the hand that we're given in this life is completely false. And there's so much that you can actually do to manage it or improve it or completely fix your symptoms sometimes, depending on what it is. And just understanding that pain, no one should live in pain. Pain's not normal. Pain is your body telling you that something is wrong. And then otherwise we hear, I thought about calling 911 yesterday because my cramps were so bad. Not normal, not normal. Something's going on. And another one we hear is I have to sit all day with a heating pad during my period and also use it when I'm not on my period. This is a huge one I see with endo patients. There's actually these basically heating pad diapers that a lot of patients will use, which are wonderful for endo. But when patients who don't have that diagnosis are saying that they need to have a heating pad on them all the time, a lot of those patients will actually get skin changes and burns because of how much they use heating pads. You'll start to see that kind of skin change when you kind of look around a patient, if that happens to be what you're doing with them. And just again, having to need that much support is not normal when there's a pattern, when there's consistencies, and when that might be getting worse.
Yeah, and just to add to the list, so huge mood swings and depression, suicidal thoughts the week before your period, they just happen. That is not normal. As we talked about earlier, PMS is one thing and to deal with, but PMDD, this is where you start to hear some of these things. That is concerning. If it is interrupting, again, that's Kellyn and I's big selling point. If it's interrupting your daily life, it's being disruptful, if your symptoms are debilitating, whether that be emotional symptoms related to your period or physical symptoms, that is definitely a red flag and is a complete misconception. Everybody fears having their period, and planning around your life around your cycle is normal. No. So if you're looking and saying, hey, I really would like to make plans to go out with my friends this weekend, but I know I'm due my period, so I think I just won't make any plans this weekend because I really get afraid to leave the house when I have my period because my pain is so bad or my bleeding is so bad, that is definitely a red flag. You should not fear having your period coming, and your life should not end because you have to sit in bed all week because you're having your period. Or at least the first couple of days. That shouldn't happen either. Some women have heavier periods and just bleed through pads or tampons every hour, or that sort of thing. That should not happen either. You should not have to be in between every class and changing your pad every single time, or your tampon, because you're bleeding through it. That should not be the case. Large clots with your period are normal. No, they are not. If they're larger than the size of a quarter, that is a big problem. As Kellyn said, little tiny clots is one thing, but if you're having huge, large clots, that should not happen.
And you'll tell the difference. I think that's an important thing, is you'll know when a clot looks like it is too big to be considered normal. So now what makes up your toolbox? So this is kind of really that nitty gritty, right? This is the goal of our class. We're giving actual concrete tools and management techniques that you can share or you can utilize with either yourself or with clients. And really it starts to answer that now what question, right? Because so often women come into a doctor's appointment, they maybe get a diagnosis or maybe they don't, and they just get brushed off and told that it's just kind of what it is. And they walk out and they're usually like, okay, so now what? I have this diagnosis. Now what do I do? Or I don't have a diagnosis, but my symptoms are still there. So what do I do? Right? So this is where this workshop really comes in and starts to answer that question and becomes that toolbox for you, so you can start to have management techniques and actually start to make a difference in your life. I think it's important to know as we go through these, right, like what's within your scope, and always making sure that you understand when to refer out, right? When in doubt, you refer out, and having a network that you rely on is super important. So having a pelvic floor PT that's in your pocket, having a nutritionist, a holistic health practitioner, those people kind of ready to go, so you can send your information, or that patient their information, or having those people so that they can give you people, right? Like they might have somebody that they can refer you to. So it's really important to kind of create that village for you.
This is what Kellyn and I do all the time.
Yeah. And so we are
fill in each other's gaps all the time with our clients and patients. So we'll be like, okay, well, she needs further help with pelvic pain. I'm going to send her off to you. Yep. This happens all the time for us, because we each have our own specialties and we work really well together and help optimize our well-being for our clients together for the best results.
Yeah. And being able to identify like the value in your village and in your support system as a provider is so helpful, because we can't do everything. We can't, and nor are we allowed to, nor should we do everything. So it's been, it's a wonderful, again, tool in your toolbox. So first tool in that toolbox is movement, right? So most of the time when patients have period pain, for whatever the reason might be, they want to engage and crunch and tuck up and stay in a ball all day. When I have to try to get them to stop doing that, it is quite a fight, because they think that coming in, that tucking in is soothing to them, but in reality, it can actually make the symptoms worse. So when we are having this pain, that instinct is going to be to stay still, but that actually will increase muscle tension and discomfort. So getting them to start to understand, like, movement is good. I don't need them to do a workout. I don't need them to exercise their hearts out. I just need them to move. And that might be just getting outside for a 5-minute walk, or it might be going through a couple stretches. It doesn't need to be anything crazy. We just don't want to stay in the fetal position. So with endometriosis, for example, we can't control that endo contraction, that adhesion contraction, but the areas around it. So if I'm always tucked in, over time, my belly is going to start to get really tight. And now that endo adhesion is going to engage on that tight belly, and it's going to get worse. So having that kind of go-to maybe 5 or 10-minute stretching routine can be super helpful, because there's no thought that goes into it. It's just kind of their go-to. And again, even maybe it's just walking, or maybe it's just standing up. And it's really, truly, movement is medicine. Motion is lotion. So starting to try to identify what are some go-to movements that are doable. Always is something better than nothing, is what I say all the time. And it just needs to be doable for the patient. They need to do it in a way that doesn't create more flare and more pain, and giving them the confidence that the movement is not going to make them worse as well.
All right, so the next part of the toolbox is supplements. Of course, that is where I specialize in, as being a certified dietary supplement professional and board certified in holistic nutrition. So I'm going to give some examples of supplements that I use in these different situations to alleviate these different symptoms. But I always want to preface to say each of your clients have individual needs, health conditions, and goals. So definitely take everybody into individual consideration. And just because I mentioned a supplement does not mean that it's one size fits all for everybody. To start with, so for menstrual cramps, there's a couple good supplements that you can do. There's one I really like to use for homeopathy for menstrual cramps. And this is really good because it's on the go. I honestly will recommend that people keep these little tablets in their purse or their work bags, because if they're at, work, or they're out with their friends and they're like, oh, my menstrual cramps are starting to get a little bit worse, they can pop a couple of these sugar tablets under their tongue and let them melt away. And it's that helps you keep going and when you're out and about. Or just adding on top of whatever you're doing for medical relief, it can be additional pain relief as well. Also, an example of nutritional supplements that you can use, one is magnesium that can be used for menstrual cramps, and omega-3 fatty acids can be a good supplement as well. In terms of hormone balancing, so there's a lot of different supplements that are out there for hormone balancing. These are just a couple examples. One is chaste tree, that's traditionally used for hormone balancing in women. It can ease PMS symptoms, encourage healthy menstrual cycling, and can help with fibroids in certain circumstances. Inositol is another example as well. This can support hormone balancing, balance out blood sugar metabolism, help with sleep, it can help with mood, and so much more. Inflammation and pain management, again, is a huge part of the protocol and toolbox when it comes to these period pain conditions. One example of an anti-inflammatory antioxidant is turmeric that you can use for supplements. There's one that from one company that I like specifically that has a combination of different things, not just turmeric itself, but of course, that's just one ingredient of an anti-inflammatory supplement you can use. CBD is also a really good example as well for pain management, inflammation, to kind of help take the edge off again, and in addition to traditional medical care, or if people want alternatives to be able to relieve their period pain, or just cramps in general. It can also help with sleep and those types of things, especially if your pain's interrupting your sleep. So there's a lot of different uses and good things that we can use for inflammation and pain management. Correcting nutrient imbalances, so of course I advocate for testing for nutritional imbalances before just supplementing, but there's a lot of different nutrient imbalances that can come with these different period pain and women's health conditions. One example is B vitamins. They're super important for energy production, and low energy can come with several of the different conditions that we talked about today and women's health issues in general. So seeing if they're B vitamin deficient could be a really important nutrient imbalance to correct. Omega-3 fatty acids, some of the deficiency symptoms can include fatigue, inflammation, changes in mood, depression, which again are all very common with the different conditions we talked about today. Vitamin C can help with oxidative stress, which is, for example, a large factor in endometriosis. So seeing if somebody's vitamin C deficient can be a really important one to look at as well. Addressing gaps in gut health. Any of my female clients who work with me on period pain conditions and hormone health are going to know that I tell them how important your gut health is to address. And anybody that's telling you that you can balance your hormones and you don't have to address gut health, they're doing you a disservice here. So GI issues often present, first of all, with any women's health conditions. Even females that are healthy, that are experiencing their menstrual cycle, can experience GI issues that come along with it. Because the gut microbiome and sex hormones can equally influence each other, and therefore they both have to be addressed and both have to be evaluated. Several of the conditions that we talked about today have symptoms of GI issues, such as endometriosis that can come with that rotating constipation, diarrhea, and that extreme bloating or that endobelly. So you really want to address the gut health as well as the hormones. Stress management and sleep support. So stress, everybody likes to blame pain for stress, especially in women's health, to say, oh, you have endo, it's all in your head. You know, that's a very common thing, unfortunately, that women do here, is that their stress is making their symptoms worse or causing their symptoms. That's not what I'm talking about here. There is a cyclical relationship, though, between stress and between pain, because in between hormones, because all of it is connected. So we want to address stress. And let's face it, women, when we're talking about today, who are fighting for diagnoses, who are dealing with all of these period pain issues and all this bleeding that they're dealing with, it's very stressful to live like that. So and then the stress that they're having because of this can then make the pain worse. And there is a just cyclical relationship between the two. So you really want to address stress, which we're going to talk about more towards the end of our toolbox too, because of course we got to bring up stress in our toolbox protocol because there's no way around it. But there's some really good supplements out there for stress management and, of course, sleep support, because pain can disrupt our sleep as well. Things like magnesium and L-theanine I'll use with my clients depending on, again, their needs. But those things can really be supportive of those. Nausea. So unfortunately, pain can come with nausea. So managing pain is extremely important in managing nausea as well, because one does often come with the other. There's some good homeopathic supplements that I personally use to help alleviate nausea with my clients, but of course, there's a lot of different ways you can go about that. My main thing, I'll use dietary supplements, homeopathic remedies, and once in a while, I'll use the herbal supplements as well. But that's kind of what makes up my supplement toolbox for my clients.
Then we have actual physical tools in the toolbox. So this is where a lot of the PT comes in. So we have E-stem, which is electrical stimulation. You can see those pads being placed on a patient's back in that top left picture. E-stem is help with nervous system modulation. It can relax muscles in that area, and it can be used up to all day long. So it is really a nice tool for patients to kind of throw onto the area, whether it's the belly or the back or hip. Provides a nice little kind of vibration of this type of sensation into the area and can help distract from the pain. So none of these tools are an end all be all. Not one tool is going to fix everything. Not every tool is going to be for every patient. So really just trying to kind of trial and error and see what ones work for the patient. Heat, obviously we know heat increases blood flow. It helps with muscle relaxation. It's often used in menstrual cramps. So we now just kind of bring that heat to the back or the hip or the belly, wherever a patient may be having pain. Acupuncture and dry needling, which dry needling is kind of like the PT version of acupuncture. So we're using needles. Acupuncturists are putting them into certain spots. I am putting them into muscle knots, areas of tension and restricted blood flow. So we can use those needles to improve blood flow, decrease muscle tension, decrease muscle adhesions, and again, a tool in the toolbox. Epsom salts, when you take Epsom salt baths, you have the salt, you have the warm water, and you have magnesium, which are all known to help, again, release tension and improve muscle flexibility. Red light, the research is still coming out, but there is some belief that it does improve inflammation and tissue healing. So having red light along the belly is a really great tool in the toolbox for cramp management. I have one that's basically like a belly wrap. I wrap it around underneath my pants and I'll wear it if I need to. So it's a nice kind of mobile, untethered device that patients might benefit from. Ball rolling is where you take a tennis ball or a lacrosse ball and you apply it to different areas of your body. You kind of gently roll around or hold pressure from the ball, and it's a great kind of trigger point release tool. And then you have the pelvic wand, which is on the bottom right. That's a tool for internal pelvic releasing of pelvic floor muscles and a great at-home use of patients or for patients for pelvic floor pain, intercourse pain, or maybe period pain that kind of extends into that pelvic floor region.
All right, so next I want to talk about nutrition. So when I talk about nutrition, I really talk about a customized holistic nutrition plan based upon your individual needs, and I teach people how to eat for their body. So one of the biggest calls that I will get from any potential client, whether it's male, female, it doesn't matter, and they will say, no matter what I eat, I still don't feel well. And I can eat super healthy and I still don't feel well. Everything I feel inflamed and I don't know what to do anymore. I've tried all the diets, none of them have worked. That's where I really come up with a customized holistic nutrition plan for people. I don't put people on the fad diets or a specific one. There's not any, for example, endo diet that I'll put people on. It's really trying to look at the facts and look at people's individual needs and try to come up with that customized plan for people. So anti-inflammatory eating in general in a whole food diet is, what I always like to say, the 80-20 rule, to eat whole foods and anti-inflammatory foods most of the time of your, that you can. And so what is a whole food? It is one singular item. So if you're looking at the ingredient list on a pepper, the only ingredient that should be on there is a pepper. It is one food, it is a whole food. Of course, again, there's caveats with all of this. Anti-inflammatory eating is great, and I can recommend certain foods that are anti-inflammatory 10 days till Sunday, but if you have a food sensitivity to it, it is not going to work. For example, like myself, I have a clinical diagnosis of endometriosis, and I did food sensitivity testing, and I was 100% intolerant to pineapples, and yet they're one of the most anti-inflammatory foods out there. But for me, it doesn't personally work. So I often recommend food sensitivity testing in my practice because this is how we find out what is not working for you. What fruits, vegetables, sources of protein, ingredients, additives, what are you personally sensitive to? And in the same regard, you got to look at addressing GI issues because this can impact nutrient absorption. So people can eat all kinds of healthy foods and say, I eat all these fruits and vegetables. What am I doing wrong? And yet their list of nutrient deficiencies on the list of the lab report is so long. And they're like, but I eat all these foods. Then your gut's off. And that's when we also have to look at addressing the GI issues. So when I do a protocol with my clients, what I usually start with after initial consult is what's called bioresonance hair analysis testing. It looks at food sensitivities, it looks at your gut, it looks at your nutrient deficiencies, environmental sensitivities, and your hormone imbalances all in one, because I, again, take a whole person approach to it and don't just look at everything fragmented. So one of the biggest things, though, that I can visualize for people in terms of healthy eating, anti-inflammatory eating, is eating the rainbow. So if you look at the picture below, it shows reds, oranges, yellows, greens, etc. And this is a plethora of all different types of colors. So when you look down at your plate and you go, okay, what colors are in my plate? That's when you realize how much in phytonutrients that you have. These are what give the fruits and veggies their color. They're full of antioxidants and they help regulate the immune system. So if you're looking down at your plate and being like, what colors do I have? I have brown. I have bread and pasta. That's not going to do you too much. You want to make sure your plate is colorful. So this is where we again brings it into nutrient-dense foods. So nutrient density is the amount of nutrients in food per calorie. So a tip for people who are watching this is to focus less on your calorie count and more on your nutrient densities. How much bang for your buck are you getting out of your food? How many nutrients are in each calorie of your food? This is really where we want to look at all of that together. So to go a little bit deeper into it, so protein is super important for everybody. It's super important for women. And I don't give on a webinar like this, for example, customized, this is how many grams of protein you should eat per day. It's really individualized for the person. And I don't do a ton of those counting in general in my practice. I'm more just focused on if they want to track it themselves, I encourage that. But I'm more focused on the sources. But in general, people living with chronic inflammation need possibly up to 1.5 to 2 times the amount of protein in the diet. So when I'm looking at women with different issues like endo that are inflammatory and, they're dealing with so much pain and inflammation, I'm like, okay, one of the first questions I ask is, how much protein are you getting? And so we really want to try, if they're like, oh, it's only like 30 grams probably in the entire day, or I'll track it, I have no idea, and ends up becoming pretty low. I try to give good food sources, again, based upon their food sensitivity testing and what their body does and doesn't like. Try to give them more food sources to keep encouraging them to increase that gram of protein per day. Fiber. So we often think of fiber one-dimensionally to say it's really important for GI health, which it is. It helps with transit time. It encourages healthy balance of good bacteria, but it also helps with hormones. It helps with the metabolism and clearance of hormones as well. So again, when we're addressing period pain conditions and women's health issues, we really want to look at fiber because it really does help with the hormone side of it. So again, as much as I don't love to give, examples of foods, I'm going to give a couple examples here, again, taking consideration of what your individual needs are. But things like chickpeas, raspberries, legumes, chia seeds, blackberries, these are all things that are high in fiber that you can add into your diet. Omega-3 fatty acids, I already talked about them in the supplement category. We're going to talk about omega-3s again. They are so important for the body. They support brain function. They help fight inflammation. They support fertility, which is so important. And things like seafood, cold water fatty fish, nuts and seeds are some basic recommendations for those. But of course, testing for nutritional deficiency of omega-3s is really important because so many people are not eating enough of these. So if we need to supplement that, then that we can. But if you can get as much in the food sources in, that's awesome as well. Vitamin D. So that is a nutrient and a hormone, which is really important to talk about when it comes to women's health. The biggest source of it is actually sunshine. So of course, right now when we're filming this, it's June. So I really encourage you to get outside and get some natural sunshine because it is so good for your body. Having outdoor time is so important in so many different ways for your body, but it is really the best source is to get it from sunshine. Of course, living in New England, our sunshine is limited. And so from probably October through April, we don't get a lot of sunshine. So of course, this is where if you want to ask your doctor for, blood work testing to further look into vitamin D deficiency and possibly need a supplement, especially during the time of the year that we get no sun, it is really important to look into that as well. And when we talk about nutrition, one thing I want to bring into the conversation is mindful eating. So if you're talking to your client and they, don't really feel well no matter what they eat, and you're trying to do all the nutrition testing and the, food sensitivity testing, you're like, okay, there's got to be something else going on here. You should ask the question of, what is going on while you're eating? Are you sitting down at a table? Are you focused on your eating? Or are you half trying to work and a lunch break and pop a granola bar in during your work day, or eating on your car ride to work or back, and having those distracted eating? It really actually does impact the way your body digests food. So focus on chewing your food fully, non-distracted eating, and eating with all of your senses. And it does make a big difference in terms of how your body takes in your food.
And then but then next we have a stress management in your toolbox. So this is not to say that this is all in your head, but it is important to acknowledge the impact that stress has on your physical body. So your pain is real. It's not in your head, but if you are stressed to the max, it's going to make your pain worse. So stress and emotions have a direct impact on your body. So they can increase how much pain and dysfunction that you might be experiencing. So when the body is under chronic stress, it's a chronic input into the fight or flight nervous system, which then will pre-contract our muscles to get us ready to fight or flight. Your brain is very illogical. It thinks of life as being a cave woman, and it thinks that running late to an appointment is like fighting a bear. It has the same response. So in this day and age, when we have chronic stress kind of all the time, low levels with everything that we do, our body is primed to constantly be in that fight or flight. And we really have to shift it into the rest and digest system, which allows us time to relax, rejuvenate, and digest food, or just kind of like digest everything. And so if you are in chronic stress and you're spending more time in that fight or flight, it can lead to increased muscle tension, a more sensitive nervous system, a decreased ability for your body to kind of calmly maintain itself, increased inflammation, and hormone disruption. And you can imagine that all of those would cause an increase in period pain, body pain, period dysfunction, and things like of that nature. So again, it's not that it's all in your head, but understanding the importance of stress and stress management is a tool in your toolbox. It is not the end all be all, but you have to acknowledge it when you're talking about pain.
All right, last but not least, let's talk about reducing toxin exposure. So as much as we can put our effort into things like nutrition and take as many supplements as we can, we also have to look at our environment, because our environment plays a key role in our well-being. So let's talk about it. Endocrine disrupting chemicals are chemicals in your environment that interrupt the proper functioning of hormones in the body. Some EDCs can act like hormones by mimicking them and therefore fooling the body into believing that they're actual hormones. Additionally, there's other types of EDCs that can impact levels of hormones by causing them to either multiply or decline the amounts of your body. So you can be working with a client, you can have them on all the best hormone balancing supplements, address their gut health even, and go, well, what's going on? What's the factor that's there is still imbalanced? We got to look at their environment, because it still can cause these imbalances to go on. All right, so this is kind of just an overall nice look at things when it comes to like a little pamphlet on EDCs and how they impact the body. So some common ones and their uses can include pesticides, children's products, industrial solvents or lubricants, plastics and food storage materials, electronics, building materials, personal care products, which we're going to talk about more in the next slide, antibacterials, textiles, clothing, and so many more. So you really want to be aware of what is going on in your environment and what could be impacting you in your own household. So this is the so what of this. What do we actually do? How do we reduce the toxin exposure? So first and foremost, the first line of defense is eating organic foods. So what we can do to put into our bodies with less pesticides, that's step one. Back to the personal care products. So reading the labels and teaching your clients or patients how to read a label of their products is really important as well. So checking these products for different buzzwords like the ones that are listed here, especially things like parabens and fragrances that can be snuck right into a lot of products, like your shampoos, your conditioners, your hand lotions, even that you think don't have a scent but have parabens in them somehow. These things you've got to be really aware of, because I had no idea until I started learning and everything holistic how many of my products actually all had fragrances in them. And it's really important to make these swaps in order to have a healthy hormone balance in your body. Some different tools to be able to do this, because it can be really overwhelming that you look at the back of a product, you're like, whoa, there's like 4,000 ingredients here. How do I know what's a problem? First of all, the less ingredients, the better is typically a good rule. But using different apps like the EWG database, you can go right on their website and type in the name of your product or even the lines of products. Like there's like makeup lines. You can look at pretty much anything in your household, including foods even, to see what the toxicity level is like. There's also an app that you can download on your phone that you can scan the barcode of, and that will kind of tell you and rank you like, the best product, how bad the product is, if it's screaming at you that it's so hormone disrupting. It will rank those different things. And some of my clients also like the Yucca one. Some people say it's more user friendly. It just really depends on your preferences. That's the same kind of thing that you can go and scan all your products. A lot of my clients will tell me, they're like, now you made me download the app, and I'm in the grocery store like double the amount of time now. I didn't realize what was in my stuff. So it really is eye-opening when you start to learn these things of what actually is in your environment. And it's a game changer to be able to actually reduce that toxin exposure in your body. Something else is drinking filtered water. So we often don't realize how much our water can be full of toxins. For example, like heavy metals, different things like that can all be in the water. So you want to make sure that you're properly filtering your water as well. Avoiding nonstick pans is super important. I'm sure a lot of people have heard about that. Reducing your exposure to plastics, making sure you're not, storing all your food in plastic, microwaving plastic, etc. Using aluminum-free deodorants. clients may be a little resistant to this one at first, that they're like, oh my God, but I don't want to smell bad. So it really takes some experimenting and trial and error to see what works for you with the aluminum, but aluminum definitely is a disrupting chemical. Avoiding artificially scented candles and air fresheners. So if you like your candles, make sure you just find natural alternatives of different candles that are more naturally made. But even like the things like you plug into the wall of the air fresheners, those can be very disrupting for the body. Reducing your pesticide exposure. So we talked about food, what you're putting in your body. We talked about your home, but what is outside of your home? So you got to look at your outdoor environment as well. What are you treating your gardens with? What are you spraying for pesticides? Try to find natural alternatives as much as you can. There are companies out there for even pesticide use that will use more organic pesticides for your yard. So make sure, just looking at the list, it can be a little overwhelming. Take it one step at a time, but just really kind of start by focusing on, okay, today I want to look at my pots and pans in my kitchen, and tomorrow I want to look at my deodorant, my personal care products, and keep just peeling back the layer of the onion. And eventually, again, time goes on, we're all still looking at these things. Rome wasn't built in a day, as I say to my clients with anything, but it takes time. But eventually you go, okay, compared to a year ago, I've made a lot of good changes to my environment that I feel like my hormones are now healthier because of that.
And then just to kind of go on the idea of building a toolbox, I wanted to share some actual legitimate tools regarding movement and kind of pelvic floor perspective. So I wanted to just kind of give this visual, which is of diaphragmatic breathing. Diaphragmatic breathing will stimulate your vagus nerve and shift you into the rest and digest system. So kind of sprinkling this into your day, making it become a pattern for you. There's plenty of videos for reference on YouTube for more instructions, but it is the idea of inhaling and your belly, your back, your sides expanding, and then you exhale and you relax that belly. Inhale, the belly fills up, exhale, it relaxes. Then with the same idea, I wanted to just identify some stretches that patients can do, and they're very simple. They're very much like yoga. You know, it just is kind of a nice little recommendation for patients. So I'll stop just for a minute or two, so that way you can screenshot these as we go through them. There's instructions, there's duration of time holding for them. Again, if you're not a physical therapist, it might not be within your scope to talk about movement, but anyone can recommend some stretches because it's pretty basic. None of these should cause any issues. And of course, if you feel like they need more, then you just refer them over to a physical therapist. But if anyone does a yoga class, they'll have had experience with any of these stretches. So it's just a good little resource for people. And now we're going to kind of talk about really truly like how can we help and understanding how to, or maybe who's the right person to refer to if that feels like something that you might come across with your clients.
Absolutely. So when to seek out a holistic practitioner. So I mentioned this a couple times throughout the webinar of really somebody who wants a whole body approach to healing. So looking at all of it together, your gut health, how to eat for your body, filling in the gaps with supplements, lowering inflammation in the body, and balancing out your hormones, looking at your environment, all those different things is when you want to seek out a holistic health practitioner. Looking for that root cause and you want a customized approach, that's also when to seek out somebody like myself. So in my practice, this is kind of an overview of what I do and the type of testing that I offer. Of course, I look at all the different dimensions, the gut health. I specialize personally in women's health. I run the bioresonance hair analysis testing. So this is kind of an overview of how I help my clients.
And then can pelvic floor PT be helpful? So the answer is yes. So basically what we do is we're a regular physical therapist, but you do internal and external. Internal is only if the patient's approving of it. There's plenty that you can do to target the pelvic floor muscles, but from the outside. So it looks very much like traditional PT. You're doing stretches, you're doing manual, you're learning how to move muscles, you're teaching pain management techniques, teaching the toolbox that we went through. If we're doing internal work, we're internally assessing vaginal or rectal pelvic floor muscles. We're releasing trigger points, we're improving coordination, and we're really working to retrain those muscles that might be increasing the patient's pain that they're feeling with their periods. So just some things to identify when to seek a pelvic floor PT. If a patient is saying pain is extending outside of the menstrual cycle, pain is interfering with work or daily life, they're having the painful bowel movements or urination, painful penetrative intercourse or tampon use, if you suspect endometriosis, pelvic floor dysfunction, or other diagnoses. So it is super helpful. They're a great person to have in your toolbox because you get into the nitty-gritty of a lot of their symptoms, and you might be able to really greatly identify a need for a pelvic floor PT for that client. So we just want to say thank you for taking the time to listen to this webinar. We hope you can walk away and have something in your toolbox, and we appreciate your time spending watching the webinar.
That was fantastic, ladies. Thank you so much. I have no doubt our members will get tremendous benefit from this. As you know, we have students, we have new grads, we have people looking to specialize in certain areas. Isabelle, I would love if we could reach out to you and perhaps get a handout with some of the supplements that you mentioned, because I've no doubt we've got practitioners. We also have allied health professionals, of course, who listen to this. So it's not just holistic nutrition professionals. We do have homeopaths, herbalists, and people who can, of course, mix their, depending on their scope of practice. But I want to thank you both. That was awesome. Thank you, Kelly. Thank you, Isabelle. I wish you all the best. And thank you guys for watching. Bye for now, everybody.
You.
Bye-bye.